Hello everyone, Dr. Suresh here, your Games Academy faculty for Biochemistry. So as a part of our FMGE case-based questionnaire for the session July 2023, I've come up with another case-based questions. So the case related to respiratory distress syndrome. So we are all aware the respiratory distress syndrome in the lipid chemistry under the classification of phospholipids we come across with one subtype of phospholipid, that is dipalmityl lecithin, which acts as a lung surfactant. So related to that I am going to explain one case based scenario. Okay, so the example what I have shown in the image, that lung shape of the lungs and in the image, and details of the question if you see, like preterm neonate. Know the key term here, preterm neonate, that means premature baby, shows increased respiratory rate, chest wall retraction, cyanosis, pallor. His condition was progressively worsening and he was put on oxygen. That means baby couldn't able to breathe because of some lung problem. X-ray chest was showing ground glass appearance. See, if you see the image on your on your left side, so the shape of the lungs is like ground glass appearance. Attending pediatrician suspected that respiratory distress syndrome. So first of all, maybe there might be one or two questions, or so many questions can be asked based on this case scenario. So we'll see the possible questions. So what is the cause of RDS in premature babies? So premature babies, it's all mainly because of what? Respiratory distress syndrome mainly affects the premature babies. See, premature babies means their body functioning is not fully developed. Lungs is also one of the vital organ which is supposed to be help in breathing, right? So because of the immaturity of the lungs, so in RDS mainly what happens in respiratory distress syndrome, there is an immaturity of the lungs, so which don't produce sufficient lung surfactant. So again the key point here, lung surfactant. The lung surfactant here, that is dipalmityl lecithin. Remember. So what is the function of this lung surfactant? Lung surfactant is produced by type 2 alveolar cells. Okay, type 2 alveolar cells, and which reduces surface tension between the two alveoli and prevents the collapsing of the lungs. It maintains the shape of the alveoli and which can help in respiration. Right. So lung surfactant is an important substance which is layered on internal wall of alveoli and reduces surface tension in the alveoli in such a manner that they are not collapsed and shape of alveoli is maintained for proper gaseous exchange. So if you see the image here, the lungs, so two types of histopathological slides also has been made to visible for you. Normal alveoli and collapsed alveoli. Normal alveoli as enough or sufficient amounts of lung surfactant is available, alveolar is in proper shape, but in RDS the shape of alveoli is not maintained because of insufficiency of the lung surfactant, so the alveoli got collapsed. So in the second collapsed alveoli, the shape is not maintained. So what is a major component of lung surfactant? So lung surfactant, as I mentioned in the previous slide, lung surfactant is nothing but dipalmityl lecithin or dipalmityl phosphatidylcholine. Dipalmityl phosphatidylcholine, it is one of the subtype of glycerophospholipid, okay, and it is produced by type 2 alveolar cells. So as I said, it prevents the collapsing of the lung alveoli during expiration. Its production increases in the gestation as gestational age advances, because its production starts in the 28th week of the gestation and production increases with increase in the gestation, right? Then how to assess the lung maturity antenatally? Okay, so the lung maturity in fetus is assessed by lecithin sphingomyelin ratio, that means popularly LS ratio in amniotic fluid. Okay, so amniotic fluid, if you check the LS ratio, Based on the normal value, you can make out whether the lung is matured or not. LS ratio of 2, it is a normal value. LS ratio of 2 denotes lung maturity and is achieved at gestational age of 34 weeks. Okay. And the risk of developing respiratory distress syndrome, I mean, like 75% chance, like increase in to the greater chance of getting RDS if LS ratio is less than 1.5. So the denoter here is 2. LS ratio is supposed to be 2 in amniotic fluid. If not, there is a high chance of getting respiratory distress syndrome in the newborn baby. So how to avoid how to avoid this respiratory distress syndrome? So as if you check the LS ratio in amniotic fluid, if the levels are less than 2, then you are supposed to inject glucocorticoids to the mother antenatally, okay, which helps in enhancing the synthesis or production of lecithin and sphingomyelin production and restores the denominator to 2. So this is all about respiratory distress syndrome. So the key points are, see if there is any uh, insufficiency of lung maturity, it may be the case of respiratory distress syndrome, and the main deficient substance in respiratory distress syndrome, that is insufficiency of dipalmityl lecithin, which is acting as a lung surfactant. Okay, these are the two key points you are supposed to, and they are produced by type 2 alveolar cells. Okay, type 2 alveolar cells, and how they act, they reduce the surface tension and prevents the collapsing of the alveolar wall by maintaining its shape during the expiration. So that's all about it. Thank you.